Great, well, thanks very much, Brent. And I really do want to thank Brent and Dennis and the respective teams from CIHI and Canada Health Infoway for putting together what I think has been a great conference. And then I obviously also want to thank you all as participants, the speakers, and everybody else who's contributed to the program, as well as the sponsors that have been mentioned earlier that, we always need some support to put on these programs. So, obviously we have come a long way since the meeting in 2008. And all the investments that have gone into e-health over the last few years are certainly creating an awful lot of data in various different sources, in various different ways and departments and organizations across the country. And over the last couple of days, we've heard how this data can be better used, to provide better patient care and ultimately to come up with better kind of personalized care. We know that one of the issues we always face in Canada is the fact that unlike some health systems like NHS England, we're not a single system, but we're 13 or 14 different systems. And that often brings up the barriers either in terms of economy of scale or different kind of strategies and focuses that different provinces and territories may have. And so it's very difficult to get a kind of unified approach. But there certainly does seem to be a renewed effort with the new government and the work with the provinces and territories to look at the new health accord. And so I think that probably more now than ever, there's more optimism about coming up with some good themes and action, of course. But also, I think, being a pan-Canadian organisation like ourselves and CIHI, we're also in that great position where we can take a pan-Canadian view, and we can, one of our roles, I think, apart from just funding and helping people implement things, is also to try and help people identify really where they should and want to focus, and then to see how we can enable that. And a lot of the issues that seem to prevent us using data and data analytics in a great way come back perhaps to policies or the way we're reimbursed. Do we have the right kind of model? Are we looking at quality outcomes and so on that really drive the value from these systems? And these are the more complex kind of change management issues that need to be addressed. The technology is there, but how can we really focus on that? And certainly now we feel that having got all of the EHRs, many of the EMRs in place, the key challenge is to move to that next stage. From an Infoway perspective, that's where our focus is certainly going to be on the next few years, and very much in our initiatives that we're pushing forward for 2016-17. We really do want to try and unlock that value for the patient and have a patient focus and help facilitate this activity to go ahead. I think the opportunity for us as a group, we've talked about these things at many seminars, but what we really want to do is have action. And now I believe we're at a stage where we can put that action into place. We still need to do things in terms of helping to enable the right kind of environment from a business perspective. Peter Vaughan talked about the ecosystem. And this is something that is kind of dear to our heart at Infoway, because we want to see how we can try and help stimulate that ecosystem so that really great ideas, great applications can be proliferated and best practice can be proliferated across the country. And we want to see how we can help everybody kind of incubate these things to go forward, and that's a core part of our program as well for next year. So I think there's some great untapped opportunities. When we come together next time, we want to see real action in place. Thank all of you for participating in the session, and I'd like to hand over to David to also say a few remarks. Thanks.
I just have a few things to say. First of all, thank you very, very much for spending your time with us over the last day and a half. There's always the temptation at the end of a set of discussions that has been as rich and provocative as this has been, to sort of ride a wave of adrenaline unthinkingly into a set of heroic statements about what you're going to do. That's contributed to by the cold medication I'm on. So I'm going to resist that and also take John's advice about incremental approaches to big change. And it really is perhaps about getting the calculus right between what to be patient about and what to be impatient about. At the same time, we're an organization that has a new mandate from our board, and I feel quite keenly the responsibility we have as a pan-Canadian organization to actually move the yardsticks on the things that we've discussed, or some of the things that we've discussed that fall into our ambit over the last day and a half or so. So a few things that I think we're going to commit to, and one of the things that begins that list is at the beginning of the discussion for our participation in this conference last October, we actually thought about all the conferences we're going to be participating in over the next 5 months. And there's a lot of them. There's some we've said no to, and there's some we've quite deliberately said yes to. We're going to continue to parse out the themes that have been identified here and broaden them out through our participation in the International RAI Conference, the Queen's Conference, and the CIHI Health Conference, just to name 3 of the 4 or 5. So that's an opportunity to parse out some of the issues where we're implicated or may have a direct role and throw more substance onto them. I think our role as a pan-Canadian organization includes the responsibility to be a convener of constituents on difficult issues, not necessarily contentious, but difficult issues. And I think one of the things that we'll be thinking about is whether we ought to be considering convening discussions on the examination of privacy legislation in the country and whether it needs to be examined with a view to modernizing and what would be the elements of modernized privacy legislation as a form of advice. We need to continue our work on common data standards and data integration and data governance. I think Dr. Hebert's comments about data governance and others about the centrality of that issue, and it falls to us in partnership with other organizations to continue that discussion and try to refine it. I think, as Robin and Neil have both identified, data integration and increased accessibility of data, broadly defined, is a responsibility that we have as an organization responsible, or the steward of healthcare information on a national scale in Canada. I think we need to continue our performance reporting on health system performance priorities, quality, patient experience, and value for money, as well as our population health priorities. But in order to make that more meaningful in the decision-making environment that clinicians and policymakers are in, to quite specifically try to evolve from a retrospective to a prospective set of analytics. Notwithstanding all the challenges that come with that, because it's difficult doesn't mean I don't think that we need to address it as a priority area. One other theme that emerged for me is the different definitions or meanings of what return on investment means depending on where you're situated in the healthcare sector in this country. And I think that there's work that we need to do on return on investment analysis, especially in the context of discussions that are going on about if you have a marginal dollar to spend in your province, perhaps you don't spend it on healthcare. Perhaps you build it in public housing. And to be able to do that effectively, we need effective data linkage, but we also need to be able to provide analytics that give some degree of confidence in an ROI analysis. But perhaps the most compelling thing that we're committing to is the need for collaboration with clinical leadership, with private sector firms, and with other pan-Canadian organizations on a selective and more focused basis. I don't think we can continue to sort of, not that we have, to be spreading our resources overly thin when in fact more value will be derived from us being focused and strategic in the selection of our partners and collaborators. Because for us to realize any of the ambitions that have been articulated here over the last day and a half is going to require intense collaboration with a smaller group of people in order to move the yardsticks. Thank you all very much for your contributions over the last day and a half. Thank you.